This is the Emergency Medical Minute.
I'm going to talk to you about a case, or the interesting part of a case. And this is at the request of one of the scribes, so you can give credit to her for this if you like it. If you don't like it, you can blame me. Gentleman came in reportedly having overdosed, according to his mother and father, but was found to be post-ictal after a seizure. In the course of his workup, he admitted to a particular agent that he had ingested to get high. In his tox screen, the only thing that turned up positive besides THC was PCP. PCP is a drug of abuse that was very popular in the 90s. We have not seen much of it recently, but frequently is laced in marijuana cigarettes. As it turns out, we can't always depend on our urine tox screens for accuracy because there are a lot of false positives. A lot of the drugs of abuse and even some of the medications we use frequently in the emergency department have similar chemical structures and actions on the brain. So not unusual to have false positives in the urine tox. In this case, this was a false positive. I'm just going to talk to you about a few of the drugs that we see as well as the medications we use that can produce false positives in the drug stream for PCP. So some of the drugs that we have used, so you don't see it anymore, is demerol. And then we see several of the antipsychotic medications like thorazine and meloril and Effexor, which can produce false positive PCPs. Some of the pain medications we use as non-opiates, including ketamine, can produce a false positive PCP. So you have a patient who's psychotic, you give them ketamine, or they get it in the field to help control their activity, but then you get their tox screen, they're false positive, or they're positive PCP. You've got to consider that possibility as a causative agent. Also, a medication we use frequently for pain, Ultram or tramadol, will turn false positive. And then bath salts. Bath salts will also do that to patients. As it turns out, this gentleman had a different agent, one that he got over the counter and was ingesting he admitted to get high, not to hurt himself, but dextromethorphan. Dextromethorphan is found in over 125 different cough medications, and in fact was the cause for his positive PCP. Now, when we do the tox screen in the hospitals, we don't frequently do confirmatory testing to prove it's PCP, which can be done if that's of concern. But just to remind everybody and to give them pause, when you do see a patient with a positive tox screen, there are other drugs that also cause false positives on other agents. But just consider that when you see PCP, because we really don't see that very much anymore as a true cause, but there are lots of other different potential ingestions which can contribute to patients' morbidity. In this case, dextromethorphan was the causative one.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.